We're going to start chapter 2, which is how ventilators work. If you're one of those people who really enjoys tinkering around with machinery, fixing cars, that type of thing, you're probably going to really enjoy this chapter. If you're somebody who anything more than a hammer kind of scares you, it might be more of an interesting chapter. We're not going to get really into depth on how the ventilator works per se, but we are going to learn about the different working parts. And as far as ventilators go, it's kind of like driving a car. Once you've learned how to drive one, you can learn how to drive another. The gas tank might be on a different side, or the light switch might be in a different spot, but you can always figure it out. I'm going to tell a story about somebody that I used to work with. So to protect the innocent, or not so innocent, I'm going to use the names Bill and Ted. So one day we were working in the MICU, which is the Medical Intensive Care Unit. There was a really sick patient on a ventilator that had some secretions that we couldn't get out, and so the doctor wanted to start something called IPV. It's somewhat like IPPV, but a little bit different. It's like CPT from the inside. It's intermittent percussive ventilation. So it still ventilates the patient, but it does so by vibrations, and it's really, really good at breaking up secretions. Okay, so we have a patient who's on a ventilator, and the doctor wants to order something called intermittent percussive ventilation while the patient's already on a ventilator, which is no big deal. It's actually something we did all the time. So Bill was the therapist, and Ted was the team leader, which means the supervisor over that unit. And Bill asked, "I don't know how to do this. I've never done it before," which is what you should do. However, Ted said, "Well, you just go in there and hook it up, and then you hit start, and you'll be fine." What Ted did not do was go in and actually explain to Bill how to do this procedure. And the end result was the patient ended up getting a massive pneumothorax and almost died and had to have 6 chest tubes. That is what happens when you don't understand the equipment that you have to use. That's why this chapter is so important. When reading chapter 2, you'll see that your book uses the analogy of a black box when explaining how to use a ventilator. I prefer to use a car just because people are more familiar with that than they are a black box from an airplane. Whenever you go to drive, you of course want to make sure you have gas in your tank, otherwise your car's not going to go anywhere. Well, you need to make sure your ventilator's plugged in and hooked up to a gas source, or else it's not going to work. With the car, you're going to put it into gear and go to your destination. With the ventilator, you're going to start it up and put it in a mode. Remember, we took it out of standby mode and gave the patient what they needed. If you want to get somewhere fast, you drive fast. If you want the air to go into a patient fast, you increase the flow to make it get there fast, just like you did on the IPPB. There are different settings that do different things, but again, it's really just like driving a car. And this chapter will help explain how some of those different modes work. When talking about the power source, we're talking about what makes the ventilator work. With a car, it would be gasoline and a battery. Without those things, the car is not going to go anywhere. Well, with ventilators, like last chapter we talked about, it could be pneumatically powered, meaning it has to have a gas source or hooked up to the dis outlet in the wall. Then there is electronically powered, which means you have to plug it in to an outlet. And you'll see pictured here a red outlet, because I want you to know that you must always, always, always plug in the ventilator to a red outlet. That tells you that it goes to a generator if the electricity were to go off. So it's a generator backed up outlet, which means if for some reason the electricity were to go off due to a storm or something else, the ventilator would still work because you have it plugged into the red outlet. It's pretty important. And then we have something called combined, which means you have to plug it into the gas source and plug it into an outlet, which is what you guys have in the laboratory setting. That's called the combined. And combined ventilators are often used with a microprocessor or a computer. The computer does all kinds of things for you. It shows the waveforms, it shows when the breath starts, it shows when the breath ends, it does the timing, and you can check the trends, which means you can go back over 1 hour, 2 hours, 12 hours, 24 hours, whatever, and see what the patient's been doing. So you can see what the compliance was yesterday compared to what the compliance was today, that kind of thing.